Dr. Alexander Scott, can you give us the current number of fatalities at nursing homes cumulatively?
Yes, 154.
Next question.
Hey, Governor.
Yeah, could you...
It's Tim White at Channel 12. So on the extra money, the raise, if you will, for the congregate care workers, nursing home workers, for those who make $21 an hour today, they probably got a kick to the gut when they were listening to your press conference. How did you come to the $20 threshold on the raise?
Yeah, really good question. So we talked to, and I will be the first to admit, as I've said every time, nothing we roll out is perfect by any means, but we spent a lot of time talking to mostly nursing home and DD home administrators and looked at the jobs that people were in, and it's a combination of the shifts that they were struggling most to fill, like, where they had the biggest shortages, and where they had, the largest number of frontline, low-wage people in certain job specifications.
Governor, it's Kathy Gregg here. Can you explain how much of a raise you would be giving each of these workers and how much money you're putting in a fund to pay the raises and where the money's coming from?
So employees who earn less than $20 an hour and work at least 30 hours a week will be eligible for a $200 increase each week from May 4th to June 1st. If you work between 15 and 30 hours a week, you'll be eligible for an increase between $100 and $200. It's prorated. We don't know exactly. We have our estimates of the cost, and Miley can go through that. It depends. We won't know, Kathy, until people apply. So, we're going to put out an application process on Monday, and nursing homes and DD homes and groups will start applying, and it's based on, how many apply and how many employees they have making less than $20 an hour.
And where's the money coming from?
It's all coming from the federal stimulus money.
I couldn't hear you. Somebody made noise in there.
The stimulus money.
The Corona Emergency Relief Fund.
Okay.
Governor, Senator Reed's office says that their understanding is Treasury wired the other $625 million from the coronavirus relief fund today. Have you heard that? Is it in the state's accounts now?
Brett and I are laughing because Brett told me 2 minutes before this call started that it just arrived.
It came in during the press conference, Ted.
Mm-hmm. And do you guys have a current estimate, this sort of pivots off Kathy's question, of how much has been roughly obligated through the many emergency actions at this point to COVID-19 response? I know we were at like over 100 last time Brenna sent out an estimate.
I want to answer that at first, and then I'm going to Brett do the details. So the answer is yes, but I do want to underscore the level of complication here because there are many sources of federal funding. So some of what we've expended, Brett's going to give you some numbers about expenditures. Some of what we've expended is going to be directly and separately reimbursed by the federal government through the Stafford Act, through FEMA, like all the PPE, for example.
Oh, okay.
The field hospitals. So none of that.
Can you please mute your phone if you're not talking?
Ted, do I have you?
Yes, yep.
Okay, so like the field hospitals will be directly paid for by the feds. The PPE, same thing. The deployment of the National Guard. Just today, in the bill that the president signed, there's another multiple billions of dollars for testing. So we got to see how much of that Rhode Island gets, and then we'll apply that towards our testing. We just answered Kathy's question by saying this money will come out of the Coronavirus Relief Fund. I think that's true, although in the bill that was just signed today by the President, there's money in that for healthcare stabilization. So we can give you a rough estimate of what we've expended, but it would be very inaccurate for you to say that that's coming out of the coronavirus.
Right, so don't just subtract that total from $1.25 billion. Okay.
And the honest, truthful answer is, I don't know yet. Because like Congress is passing, they just passed something, the President signed it today. Next week, they'll tell us how we can spend it. So it's going to be a while before we can do the puts and takes and true up. And we're still waiting for guidance from the Government Accounting Office and the Federal Inspector General on what kind of accounting they want from us. So it's like highly fluid. Now, with that, Brett, tell them what you got.
Ted, it's up to about $150 million of actual expenditures, and it's growing, right? It's not growing all that quickly. The last time we reported out, it was about $100 million. But even one more layer of complexity to the governor's point, the CARES Act, which includes the Corona Relief Fund, was actually the third piece of legislation out of Congress.
Right.
So the Department of Health, for example, got some money from the CDC, and some of the expenses through RIDO came through some funding that came in those first two, and nobody's even those. We certainly are, but it's not in the popular discussion about what the various buckets of funding are. So, I believe Brenna's committed to that encumbrance report that was shared with the legislature is going to be coming out regularly, but that's the approximate as of today.
Thank you.
Governor Ryan Belmore here. How often are you in touch with Governor Lamont and Governor Baker? Are you trying to sync up reopening dates? Right now, Massachusetts is scheduled for May 4th. Obviously, we're May 8th. Connecticut's May 20th. Governor Baker said today that he's not interested in announcing any opening dates or opening plans until they're past the surge. Are you trying to sync up the opening dates for all three states at all?
No, I talk to them all the time. All the time, like every day, every other day. We're in very close touch. We're not trying to, I feel confident I can speak for all three of us. We're not trying to sync up on a specific date. In fact, I suspect we'll have 3 different dates, or it's likely we would. What we're trying to sync up on is like a similar approach, an approach to testing. An approach to the guidance that we give businesses, an approach to what's a safe level of contact tracing. We're definitely, Nicole, for example, we talk a lot around, like, we're talking about these serology tests, how to validate tests. So we're trying to align on our approaches, but not on our dates.
Governor, I had a last night ask me or tell me that he's planning on having thousands of people come from out of state to Mesquamaket Beach this summer, including in June and July, simply because there's not enough law enforcement to stop these incoming potential tourists. I mean, is that something that's on your radar right now, or is it just too far down the pike to be concerned about?
That's highly concerning. But I haven't heard of it, and again, I'm trying to. The next 4 weeks are a sprint. My team and I have laid out a sprint plan for the next 4 weeks. We have so much to do to get this economy starting again, and then after that, I'll start to think about the summer.
Governor,
Representative Lima has backed the plan from the Trucking Association to hold off on the truck tolls. I know you said weeks ago that you didn't want to do that. Any further thoughts on that?
No. I have not changed my position. No. I don't understand why we would do that.
If you could, just what's the rationale?
Why would we do that?
No, I guess they want to give a break to the truckers. If you could just explain again why you don't want to do it.
Because it makes no sense and serves no purpose.
Okay.
Well,
Governor, on nursing homes, is there any plan to assign volunteers from Rhode Island Response to work at nursing homes right now that are short-staffed?
Very hard by the issue with the economy.
Ted, we'll take you we'll take you next. Can you answer, Nicole?
We have,
Nicole, go take that. Sorry, Nicole is getting a call from the head of the CDC, and we've been dying to get in touch with them, so I'm making her take the call.
Okay, we'll take your question, Ted.
Okay, I was just going to say, Governor, I mean, Brian's question, I obviously truck tolls are your policy, but the truckers feel like they're getting hit hard and their companies are suffering like everybody else, and they're asking for relief. I mean, it might sound flippant to them, that answer.
Say the question again. I appreciate you, Ted.
Just that, the audio that goes on.
I didn't actually hear the first part of Brian's question, if you want to know the truth. So start over.
The truckers are asking for relief on truck tolls because they would argue, like many industries, they are suffering right now. And, clearly that's not the policy of your administration, but you said it makes no sense. They would say it makes sense. It would help us, get through a tough time.
Yeah. Okay. So it's the reason that I reacted that way is, as I look at the state's revenue forecasts, now is not the time to be foregoing revenue. And the tolls are a use fee. If you are paying the toll, it's because you're using our roads and, abusing them, which is to say, big trucks cause the most damage. So if you are open for business and doing commerce in Rhode Island and using our bridges, then it just stands to reason that you would continue to pay a toll so we can continue to maintain the bridges so that they are safe.
Governor, on nursing homes, is there any plan to assign volunteers from Rhode Island Response to work at some nursing homes that are particularly short-staffed?
yes. The websites that we have spoken of multiple times, RIResponse.org is what we have accessed for being able to get workers into nursing homes and other congregate settings. We also have our congregate setting support team that is mentioned as a way to dedicate targeted resources to nursing homes and other congregate settings that need the assistance. And then all of the additional steps we have taken to establish workforce stabilization, making it easier for people to get trained to become a certified nurse assistant or feeding assistant, getting students into the workforce and other possibilities, all of which can involve volunteers who are interested as well.
Do you have any numbers on how many people have been assigned to nursing homes from Rhode Island Response?
I don't have that in front of me, but we can certainly assess.
Director, I have a question for you about hotspots. Now, we see that two food companies, Daniele and Taylor, have been identified as hotspots for coronavirus, and of course the nursing homes. What other places are you looking at that have had at least 20 or more cases?
Those two are the other manufacturing-related places that have 20 or more, and then we certainly have the other congregate settings that we are looking at, the cases and unfortunate deaths that occur in our nursing homes with higher numbers are where we are focusing as well.
But you're not seeing any other companies or any other locations that have also produced, several dozen cases?
Not to that level, no.
Okay, thank you.
There was a question from Elizabeth Graham that was asked that Dr. Nicole didn't get to. Can we go back to that question? Elizabeth, if you are still on and can rephrase it.
Different from volunteer.
She's off. Okay. In that case, we've got about a minute left.
Governor, are you anticipating, as far as the program for CNAs and frontline healthcare workers, the $200 or $100 stimulus, do you plan on that being expanded to other workers that are on the front lines, whether it's grocery stores, whatever?
We don't have plans for that right now. No. As I said, I continue to push. I do think Congress should do that. I hope that when they do what they're calling COVID-4, the next stimulus, that they will consider relief for all low-wage workers. We did this as I said to Tim White, it is a temporary, imperfect initiative that we designed to try to meet the immediate crisis needs of private providers of congregate home care. They are really struggling with worker shortages to fill their shifts. They're taking care of really sick people. No, this is what we're doing right now.
Governor, I'm staring at a press release from the Rhode Island Healthcare Association where they're thanking you for providing the extra money to the workers, but they're calling it a forgivable loan to nursing homes.
Right.
Is that how you're structuring it?
Yes.
And why?
Exactly.
And under what conditions would it be forgiven?
If it is doled out, so that's exactly right, Kathy. So on Monday, the nursing homes, for example, would make an application to the Office of Health and Human Services for a loan of X, and if they use the money in the way that I described, wage bonuses of this kind, then the loan will be forgivable.
Okay, and if they don't, if they just use as loan money, then they have to pay it back, I gather?
Exactly.
Okay.
And, we, as you can imagine, I'm trying to balance speed to execution, like trying to get PPE to people who need it, trying to get tests to people who need it, trying to get money to people who need it, also with ease of administration. So we did look at doing like direct wage payments to people, but this just is, for so many reasons, after consultation with providers, budget office, what's going on in other states, we just decided this was the easiest way to administer it. So that's why we came up with this. Do you have anything to add, Brett? Can I offer one thing to get ahead of a question that I know you're all going to have?
Yes. Sure, you're the governor.
So, is Ted Nisi on this line?
Yeah, that's who was being sarcastic.
What did he say?
He's being sarcastic.
Oh, I'm so sorry. It's hard for me to hear. I'm trying to stay away from everybody. So you had yesterday. I was so excited that we didn't have any cases in our veterans home. But now we have one. And one staff. So I shouldn't have joked around with you. It was only a matter of time. So we've got one resident who's positive and one staff who's positive. We're obviously, very concerned and focused on this for all the obvious reasons. We have a plan to test all of the residents and staff at the home. And also employees will have to fill out our screening tool to just make sure that employees are healthy when they report to work. So we're on it and going to stay on it. I actually had a call yesterday with Secretary Wilkie, who runs Veterans Affairs nationally, and I'm hopeful that they'll be able to help us out too with cleaning supplies and staff. But this is, we got to stay on this.
This is Nancy. There's a lot of talk in the veterans home that it's new and different staff quite frequently. So it's not the set group of nurses, but maybe per diems or fill-in nurses. That's been something they've been talking about.
So what we have done in this situation is quarantine the 16 residents who live near the resident who tested positive. That resident is not mobile and had little or no contact with other residents in recent weeks. And so from the staff perspective, we are designating staff just to the residents that are being quarantined, and they will not have contact with other residents, and that will address the question of different types of staff. And then those staff will arrive and leave work through a separate entrance of the building from the main entrance to help with the cohorting and separating out of both staff and residents as we continue to be aggressive in our response.
Okay, everyone, we're at time for today. We'll be back tomorrow. Thank you.
Thank you.